secret pen. No?
To be entirely honest, I lost count.
Oh! Mortal Kombat versus Street Fighter, Marvel versus DC, and even James Bond versus John Wick? What? Today we're back at it with round 2 of reacting to and breaking down some of the insane injuries and over-the-top medical scenes from the highly popular YouTube channel Death Battle. Let's dive right in.
Drinks are on me.
I prefer to be alone.
Unfortunately, I wasn't asking.
Oh. Wait a minute.
Yeah, I got a question there.
Where'd the bullet just go? If that bullet went right in the abdomen, you'll have some blood stains, obviously. But it doesn't just hit soft tissue. It can hit organs. It can hit your intestines, your liver, your spleen, your aorta, your inferior vena cava. So all these major structures that are in your abdomen. Oh. Punching somebody in the face, you're hitting a hard bone. Typically, there's not a lot of tissue there. So you increase the risk of breaking your own metacarpals, the bones of the hand here. Oh, that was cool, whatever that was. Gets a fiery flame to the left side of the chest. Doesn't go through, obviously, but it has enough power behind it to knock him on the ground. He's able to put out the flames by patting it out, which is fine. You do increase the risk of burning your hand. It takes a lot to actually burn the palms of your hand versus like the dorsal aspect of your hand, which is the top part. So we're here, we got a lot of hand-to-hand combat, and then like a suplex. Flipping somebody over top onto their upper back, maybe onto their neck, increase the risk of cervical spine injury as well as cervical bone fractures. The secret pen. No?
To be entirely honest, I lost count.
Oh! An explosion large enough to pop through the floor is going to do a lot more damage to your body. The most common simple things that could occur besides burns to your skin, shrapnel, you could pop your eardrums. Obviously, you'll have decreased hearing. And then also you always worry about any trauma to the lungs. Oh, what? James Bond just took a knife to the left side of the chest. So it depends how far left and how high on the chest. If you're low and left, you're gonna hit potentially the left side of your heart, the left atrium, or the left ventricle, which swings over that way. If you're far enough left and high, you're just gonna hit lung tissue, maybe some blood vessels. Oh. We got him on the right side of the chest, which again, unless you have dextrocardia where your heart is flipped to the other side, it's gonna hit your lung tissue. Even though James Bond took a knife to the left side of his chest, he's still able to survive. And if you haven't noticed, he didn't pull it out. Whoa. Laser beam watch, I need one of those. Oh, John Wick loses. Having a large object fall on you, yes, depending on how high it is, it can fall with great speed, a lot of weight behind it, and if it hits you in a certain area, skull fractures, intracranial bleed, it can cause compression injuries to your whole body. If somebody, mere mortals, not this big, gets hit by a bus, it's quite detrimental. You probably get a CT head, neck, chest, abdomen, and pelvis with any extremity x-rays that you need, just because it's really hard to know. Your adrenaline up, you feel fine, but you don't know where exactly the pain is. Whoa! You're slamming through a bus. All I can think about is like the glass, the metal. How do you not cut yourself? The skin must be so strong and resilient. Oh, there you go. Just ripping a car apart, super strong. They're landing on their feet. We always worry about calcaneal fractures, which are your heel fractures. They can snap all the way up. So if you have any back pain after jumping and landing from a high surface, you definitely need to get checked out to make sure you don't have vertebral column fracture. Oh, the Hulk using the compressive force. It's actually kind of a cool move. Since this guy is so jacked, maybe his eardrums are jacked too. Oh! Hulk steps right on the forearm. We see some blood go flying. You can have an open fracture. You fracture a bone and it actually pops through the skin and then makes its way back in. It's a dirty wound now. You really got to clean it out. You got to put somebody on antibiotics, and then you talk to an orthopedic surgeon about it. Whoa. Just stabbed Hulk right in the leg. Lateral aspect of your thigh has something called your IT band. The muscle that attaches to the lateral aspect of your knee all the way up. Oh no, Hulk, you're going down. Look at the anatomy. We got some good vertebrae in the neck. Obviously, there's no spinal cord. And it looks like the trachea coming down and then it branches the lungs. Oh. A lot of like soft tissue injury, bruising, ecchymosis, hematomas that could occur. These are all funky, fun words that we get to use to document blood leaking out of our tissues in different ways and swelling of the tissue. These guys have lots of muscle, so that also means lots of blood flow, which means they can bruise pretty well, but they can probably also withstand a lot of trauma. Oh! Oh, there's the hammer, bringing down the hammer.
Pick up the hammer!
I see occasional hammer injuries that come to the emergency department either on the work site or just using it as a weapon. Usually causes blood trauma, probably some more lacerations. Oh, broken hip, broken ribs. If you get hit on the ribs on the lateral side, you worry about your lung, but you also worry about the spleen that's on that side that can rupture and bleed into the abdomen. And when there's blood free in your abdomen, it actually hurts a lot. It actually hits those other organs and kind of irritates them.
Is that your best? Weak, pathetic.
I mean, the graphics are good. Oh! Uppercut to the chin could definitely break some teeth, fracture your jaw, and it's also definitely going to jar you to make you feel kind of woozy and dizzy. Oh, the noise. I worry about fractures not only of the neck from that hyper extension going backwards. You have dislocation of the vertebrae. Then you can have dislocation of the shoulders themselves coming out of socket. Oh, cool imagery.
Yeah.
We actually see a skull fracture. It looks like a blood vessel, but I'm assuming that is a depiction of a fracture.
Feel the wrath of Shao Kahn.
Big, huge, not blunted object. There's a spike at the top of that hammer, straight through into the frontal lobe. Whoa. I mean, it shouldn't be anything for Flash just to get out of the way. Flash is super fast, so it's really interesting. You're going that fast. It's actually really tough to breathe, right? You know, put your head out of a window, and when you're going fast or in a convertible, it's like, can't breathe. So I wonder if he's got that ability as well.
Excuse me, sir. I'm in need of your services.
What? Holy cow. Just took off all extremities and now you're seeing the ribcage and the skin just melting away. What? Major road rash. We see people coming in the emergency department after car accidents, motorcycle accidents, and they slide on the road and they just like rip away tissue. And sometimes you need a skin graft. It may not heal if it's too deep. Oh man, I knew that was gonna happen where just all the tissue is gone. We just see the skeleton bleeding. Good depiction of it. If it's just your soft tissue, it's just gonna cause a lot of pain, some blood loss. It could actually be repaired. It was a lot of fun. This was so entertaining. If you guys enjoyed this, definitely check out this playlist right here, binge watch everything, and do me a favor, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.